With Chinese New Year coming up, I thought this would be a great opportunity to reflect and talk about a certain type of psychotherapy called acceptance commitment therapy. It's developed by a psychologist by the name of Dr. Stephen Hayes. Now, this framework is considered a third wave of behavioral therapy. Now, before we continue with acceptance commitment therapy, I want to just explain a little bit more about what these waves mean. So the first wave of behavioral therapy was based off of the premise that our behavior was the outcome of our psychological processes. And so anything that we wanted to change in terms of our thoughts, we would first change through our behaviors. And this was developed from a psychoanalytic point of view and has evolved over time into the second wave of cognitive behavioral therapy in the 60s and 70s. Now, this very Western approach to therapy indicates that there's a relationship between your cognitions, your feelings, and your actions or your behaviors. Now, the reason why this is the next part to behavioral therapy is that we do take into consideration how your feelings and your cognitions affect your actions and vice versa. The third wave now incorporates more mindfulness and spiritual aspects of your cognition. So it doesn't take just into consideration what you do, not only what you feel, but also what is meaningful to you. Among the core principles of acceptance commitment therapy is that healing and recovery is promoted through the cultivation of acceptance and mindfulness. This brings me back to Chinese New Year and why this is so relevant right now, because this cultivation or this merge between mindfulness, acceptance, and our psychology, increasing interest in the application of mindfulness and Eastern traditions in mental health problems. So for example, Jon Kabat-Zinn was among the first to practice mindfulness and Zen Buddhism as a treatment, which is now called mindfulness-based stress reduction program. Now, coming back to ACT, Stephen Hayes, the founder of ACT, wrote an early paper on how acceptance commitment therapy and Buddhism are related, how the tenets of Buddhism is incorporated into ACT, but also what some of the differences are. Some of those similarities include that suffering is a key part to the human condition, and that it's not something to be avoided or to be eliminated, but something to be accepted and to really embrace as being part of who we are and how we approach life. The 6 core processes of acceptance commitment therapy include acceptance, diffusion, and this can include both cognitive and emotional diffusion, self as context, values, present moment, and commitment and action. In addition to the explicit use of the concept of mindfulness in this, the therapeutic techniques of ACT implicitly incorporate other aspects of Buddhism. However, ACT is very different from other traditional psychotherapy modalities in one key way. ACT is not about getting rid of, ignoring, and removing uncomfortable feelings and thoughts. It's about embracing them. ACT asks, what if the goal isn't to feel better, but to live better? ACT teaches us skills to improve our psychological, emotional flexibility. That means being able to stay present, open, and aware, even when life feels hard, and still take those steps that matter to you, that are in line with your values, living a life that is meaningful to you. ACT is strongly supported by research to improve symptoms of anxiety, depression, stress, chronic pain, and burnout, largely because it helps people from being stuck in that internal struggle and learn how to accept what is. So let's talk about what acceptance is. And this is a very misunderstood topic because by definition, people believe that acceptance means resignation. It means, especially for high performers, lowering your standards or not being able to perform at that high level. It doesn't mean liking what you feel. Acceptance really means I can allow this feeling to be here without it hijacking my day. I can accept this thought that I'm having without believing it as truth. So many of us spend energy trying to eliminate discomfort when really ACT teaches us to embrace it. The more we struggle against what we feel, the more trapped we become. So the one thing that we're trying to avoid is usually the one thing we're trying to manifest. And so acceptance is really about stopping that fight And this is where ACT really begins to sound similar to Eastern philosophies. In many Buddhist traditions, mindfulness is about learning to observe experience without trying to change it and without attachment. According to Buddhism, enlightenment is all about realizing the true nature of things, and that things are not attained merely by faith or intellectualization, but rather through being, learning, and processing through personal experience, practice, meditation, and supported by the community. And so it's this idea that thoughts will arise, feelings will come up, but we practice noticing them like passing clouds. Rather than gripping or resisting, we are just witnessing them. And this is deeply in line with ACT's practice of acceptance, present moment awareness, and cognitive and emotional diffusion. The letting go of our attachments that is facilitated by the core ACT process, including diffusion, is seeing thoughts as thoughts and making sure there's no evaluative judgments or future worries. And acceptance is the willingness to accept the internal and uncontrollable experiences, while the present moment is awareness of the now. The self is context, is not confusing ideas or concepts with other internal experiences with a sense of self. And so coming back to the original reason why I'm making this video, which is that Chinese New Year reminds us that life moves in cycles, and season shifts, and energy changes, and we begin again. And within the ACT framework, we would say that we are not defined by what our year was. We are not our anxious thoughts. You are not your past, but you are the awareness underneath it all. A part of you can notice, breathe, and choose what action you want to live in the present moment as aligned with your values. So instead of making resolutions based off of pressures, expectations, ACT invites you to ask a different question. What values do you want to live by this year? Don't ask yourself, what do I want to fix? What do I want to change? The question really is, how do I move towards something that matters to me, even when the discomfort is present? And that's where a lot of New Year resolution goals fall short. They only focus on the change. They only focus on the outcome, but they don't focus on the process. And so as we enter this Lunar New Year, remember, you don't have to fight your inner world to move forward. Like Eastern philosophies guide, as well as how ACT confirms through science, freedom doesn't come from controlling every thought, but it's learning how to hold it and experiencing it without letting it take over, and still choosing a life that matters most to you in alignment with yourself as your present moment, in alignment with your values, and in alignment with cognitive and emotional flexibility. And so with that, I'm wishing you a year of flexibility, grounding, and meaningful growth. And if this practice, if this sounds like it resonates with you and in alignment with what you're looking for, feel free to subscribe, reach out for therapy, click link in bio, and I'll see you next time.